Kate Langley, who lives in London, England, knows to her cost how devastating depression can be.
I was, a long way from home and had loads of work to do, and I'd split up with a boyfriend, and I don't know, all sorts of things kind of came at me at once. It did really affect my life at university, more than I realised at the time. I can see it a lot now. Socially, obviously at university is supposed to be, so much fun and make lots of friends for life, and it really did impede that for me. It's basically just that you don't want to get out of bed because you just feel like there's no point. You just don't want to speak to anyone, you just don't want to be there. You'd rather, I don't know, sometimes you do think you'd rather not be around than be living and feeling the way that you do. I started working in London, and after about 8 months I was no longer able to work, and I lost that job. During that time I would be really up and down. My GP would put me on medication. 6 months later they'd take me off it because they expect you to be better because you've taken it for 6 months. And yeah, my symptoms were less, but I wasn't better, and I still didn't understand why it was really happening to me and why it kept coming back. People who haven't experienced it themselves or experienced a loved one who has been through it, I think really just don't get it, and it's really hard for them to understand, I think, the kind of total hopelessness that you feel and the disbelief in yourself or anything. When we started practicing the CBT, I did find it a little strange at first to get used to, but the way they just really broke it down into, finding the negative thought that was making me feel down or anxious. So really focusing down on what was the root thought that was making me feel uneasy or crying or whatever. And then with Marina we would go through a kind of reasoning process to say, well, no, actually that's not true. What facts are there that exist to dispel that thought? And a lot of the time we would end up looking at an example, I don't know, like I'd tried to go to a meeting or a party and someone I knew had blanked me, and I would spiral into a panic, and I'd clam up and I'd think, right, I must have upset them, I must have done something wrong, I'm obviously not good enough for them to talk to me, I better not say anything. And we would look at it, and sometimes we would just end up laughing, because when you look at it realistically, maybe that person just didn't see you. Maybe they were having a really bad day and were so focused on other things they just totally didn't see you, and it really just cut through all the assumed negativity that I had. It was in some cases just common sense, and because I'd become so used to the way I was behaving, I couldn't see that. Other people would try and tell me it, but until you looked at it in detail and started to believe this person who was helping me practice it, you would believe the negative thoughts. Slowly we noticed that every time I came to see her I would come with less and less that I needed to go through. And that was really it. When we kind of sat down a few weeks in a row and said, how's your week been? And I was like, yeah, it was fine. And we didn't really have anything to go over, and that was the natural kind of end for us. Things have changed a lot. It's been really good. I've changed jobs, I've moved flats, I feel like I've really got my career back on track, whereas before I was worried that I was just going to be an ill person forever who never really had a career. Obviously socially things are really different, and I don't have a massive group of friends, but friends that I've had for a long time, and they were all really supportive and around for me, and they know me, and that's what matters really. So it's nice to be well. It was the key to helping me feel better, and I know it was, because I didn't just want to be on drugs, I wanted someone to help me fix it and break whatever it was that I kept falling back into, and I think that's what it did. It helped me get down to the roots of what I was thinking and feeling that was keeping me in that horrible place, and it's definitely been a big part of me getting better.